You may think the food on your plate is harmless. A glass of grapefruit juice, a bowl of spinach, a cup of coffee with breakfast, a little milk with your morning pill, maybe even a salt substitute because you are trying to protect your blood pressure. But after 60, some of these everyday choices can quietly change the way your medicine works inside your body. And the surprising part is this: the food may be healthy, and the medicine may be necessary, but together at the wrong time, they may cause problems. This does not mean you should panic. It does not mean you should stop eating healthy foods. And it absolutely does not mean you should stop taking your prescribed medicine. But it does mean you need to know which combinations deserve caution, because many seniors do everything right. They take their pills every morning. They try to eat better. They drink more juice, add more greens, reduce salt, or eat yogurt for their bones. Yet they may still feel dizzy, weak, unusually tired, short of breath, or confused about why a medicine suddenly seems too strong, too weak, or unpredictable. Doctors and pharmacists pay close attention to food and medicine interactions because your body changes with age. Your liver may process medicine more slowly. Your kidneys may clear medicine less efficiently. Your stomach may absorb pills differently. And if you take several medicines at once, even a small food habit can matter. So today, we are going through 7 common medicine and food combinations that people over 60 should never ignore. Number 1 is certain cholesterol medicines with grapefruit. This is one of the most famous food and medicine interactions, but many people still miss it because grapefruit looks so healthy. You may have been told to eat more fruit. You may enjoy half a grapefruit at breakfast, or maybe you drink grapefruit juice because it feels refreshing and light. But if you take certain cholesterol medicines, especially some statins, grapefruit can interfere with how your body breaks down the medicine. The concern is not that grapefruit is bad. The concern is that grapefruit can allow higher amounts of certain medicines to stay in your bloodstream. For some people, that may increase the chance of side effects. This is especially important with certain statins used for cholesterol, such as simvastatin, lovastatin, and sometimes atorvastatin. Not every cholesterol medicine reacts the same way, but you should never guess. The warning signs may be easy to overlook. Muscle aches that feel stronger than usual, weakness in the legs, unusual tiredness, dark urine, pain that you assume is just aging, arthritis, or sleeping in the wrong position. Now, most muscle pain is not an emergency. But if you take a cholesterol medicine and suddenly notice severe muscle weakness, unusual pain, or dark-colored urine, it is worth contacting a healthcare professional promptly. The safer habit is simple. Check your medicine label. Ask your pharmacist, "Can I have grapefruit or grapefruit juice with this medicine?" And remember, this includes grapefruit juice, fresh grapefruit, and sometimes similar fruits like pomelo or Seville oranges. Do not stop your cholesterol medicine because of this. Cholesterol medicine may be protecting your heart and blood vessels. Just ask whether grapefruit should be avoided or whether a different medicine or fruit choice is safer for you. And the next one is even trickier because the food involved is usually one of the healthiest foods on the table. Number 2 is warfarin with sudden changes in leafy green vegetables. If you take warfarin, sometimes known by the brand name Coumadin, food consistency becomes very important. Warfarin is a blood thinner. It helps reduce the risk of dangerous blood clots. Some people take it because of atrial fibrillation, heart valve problems, past clots in the legs or lungs, or other medical conditions. Now here is where many seniors get confused. Leafy greens like spinach, kale, collard greens, broccoli, parsley, and Brussels sprouts contain vitamin K. Vitamin K helps your blood clot normally. Warfarin works partly by affecting vitamin K activity. So, if you suddenly eat a lot more vitamin K than usual, warfarin may not work the same way. If you suddenly stop eating greens after eating them regularly, the effect may also change. This does not mean leafy greens are dangerous. In fact, they can be very healthy. The mistake is not eating greens. The mistake is making big, sudden changes without telling the clinic or doctor who monitors your warfarin. For example, imagine a senior who rarely eats spinach. Then, one week, they decide to become healthier and start drinking green smoothies every morning. That change may affect their blood test results. Or imagine someone who eats salad every day, then loses appetite for 2 weeks and stops eating vegetables. That change may matter too. Warning signs of too much blood thinning may include easy bruising, nosebleeds, bleeding gums, blood in the urine, black stools, or bleeding that takes a long time to stop. Warning signs that clotting risk may be increasing can be more serious, such as sudden leg swelling, chest pain, shortness of breath, or stroke-like symptoms. If you ever have sudden weakness on one side, face drooping, trouble speaking, chest pain, or severe shortness of breath, seek emergency help. The safer alternative is consistency. Do not suddenly remove all greens. Do not suddenly add large amounts. Eat a steady pattern and tell your healthcare provider if your diet changes. Also, be careful with cranberry juice, grapefruit juice, herbal supplements, and certain teas if you take warfarin. These can also be a concern for some people. A simple takeaway is this: if you take warfarin, do not make a healthy diet change in silence. Mention it before or during your next blood test appointment, and stay with me, because number 3 is a mistake many people make when trying to lower blood pressure naturally. Number 3 is blood pressure medicines with potassium salt substitutes. Many seniors are told to reduce salt. That advice can be helpful for blood pressure. So they go to the store and buy a product labeled low sodium salt or salt substitute. It sounds like the perfect solution, but some salt substitutes replace sodium with potassium. And for certain people, especially those taking specific blood pressure or heart medicines, too much potassium can become risky. This is especially important if you take ACE inhibitors, ARBs, or potassium-sparing diuretics. You may know these medicines by names such as lisinopril, enalapril, losartan, valsartan, spironolactone, eplerenone, or amiloride. There are others too. These medicines can be very useful. They may protect the heart, blood pressure, kidneys, or fluid balance. But some of them can raise potassium levels in the blood. Potassium is important for muscles and the heartbeat, but too much potassium can affect heart rhythm. The dangerous part is that high potassium may not always cause obvious symptoms at first. Some people may feel weak, unusually tired, nauseated, lightheaded, or notice heart palpitations. Others may feel nothing until a blood test shows the problem. The common mistake is thinking, it is sold in the grocery store, so it must be safe for everyone. But after 60 especially, if you have kidney disease, diabetes, heart failure, or take several medicines, even a salt substitute should be checked. This does not mean you should avoid bananas, potatoes, tomatoes, or other potassium-rich foods unless your doctor has told you to limit potassium. Food advice depends on your health condition and blood test results. The practical step is to look at the label. If the salt substitute contains potassium chloride, ask your doctor or pharmacist before using it regularly. And if you have been told your potassium is high, do not ignore that result. Ask what foods, salt substitutes, supplements, or medicines may be contributing. Never stop blood pressure medicine on your own. Instead, bring the salt substitute container or a photo of the label to your next appointment. That small action may prevent a serious mistake. Now, number 4 is one many seniors do every morning without thinking, because it happens with the first cup of the day. Number 4 is thyroid medicine with coffee, breakfast, calcium, iron, or soy too close together. Levothyroxine is a very common thyroid medicine. Many older adults take it for an underactive thyroid. It is usually taken in the morning, and people often take it right before breakfast. But thyroid medicine can be very sensitive to timing. Coffee, food, calcium, iron, soy milk, fiber supplements, and some antacids may reduce how much of the medicine your body absorbs. That means you may be taking the pill faithfully, but your body may not be getting the full amount. This is where many seniors feel confused. They say, I take my thyroid pill every day, so why are my numbers still off? Sometimes the answer is not the dose. Sometimes it is timing. Imagine taking levothyroxine, then drinking coffee 5 minutes later, or taking it with a calcium-fortified drink, or swallowing it with breakfast because you do not want an empty stomach. Over time, this can make thyroid levels harder to control for some people. When thyroid medicine is not absorbed well, some people may notice fatigue, constipation, cold sensitivity, dry skin, weight changes, slow pulse, or low mood. But these symptoms can also come from many other causes, so testing and medical guidance matter. The safer routine is to take levothyroxine exactly as your doctor or pharmacist instructs. Many people are told to take it with plain water on an empty stomach and wait before eating or drinking coffee. Calcium and iron supplements are often separated by several hours, but your own instructions may vary. If mornings are difficult, ask your doctor whether a bedtime routine could work for you. Some people can take thyroid medicine at night, but it must be separated from food and other medicines properly. The key is not perfection. The key is consistency. Take it the same safe way every day, and tell your doctor how you take it before they adjust your dose. And number 5 is especially important, because it can make an infection medicine less effective when you need it most. Number 5 is certain antibiotics with dairy or calcium-fortified drinks. Many seniors take antibiotics for urinary infections, chest infections, skin infections, dental infections, or other problems. When you are prescribed an antibiotic, you want it to work properly, but certain antibiotics do not mix well with calcium at the same time. This includes medicines such as ciprofloxacin and some tetracycline-type antibiotics such as doxycycline. The calcium in milk, yogurt, cheese, calcium-fortified orange juice, or some fortified non-dairy milks can bind to the antibiotic in the stomach or intestines. When that happens, your body may absorb less of the medicine. The danger is not always a dramatic side effect. The danger may be that the antibiotic does not work as well. For a younger person with a mild infection, that may still be a problem. But after 60, infections can become serious faster, especially if you have diabetes, kidney disease, lung problems, or a weaker immune system. The common mistake is taking an antibiotic with breakfast because it feels easier on the stomach. For example, a person may take ciprofloxacin with a glass of milk or yogurt, thinking they are protecting their stomach. But for some antibiotics, that may reduce absorption. Now, not all antibiotics have this problem. Some can be taken with food. Some should be taken with food, some should not. That is why the label and pharmacist instructions matter. The warning signs that an infection may not be improving include fever that continues, worsening pain, burning during urination that does not improve, shortness of breath, confusion, weakness, or symptoms coming back soon after finishing the medicine. The safer takeaway is simple. When you receive an antibiotic, ask one question before leaving the pharmacy. Should I avoid dairy, calcium, iron, magnesium, or antacids near this dose? If spacing is needed, your pharmacist can tell you how many hours to separate them. Do not guess, because the timing can vary by medicine. And do not stop an antibiotic early just because you feel better unless your doctor specifically tells you to. Take it the way it was prescribed, and call if side effects or confusion about timing occur. The next one is a medicine many people take to protect bones, but one morning mistake can make it much less useful. Number 6 is osteoporosis medicine with coffee, milk, juice, mineral water, or breakfast. Many older adults, especially women after menopause, are prescribed bone-strengthening medicines such as alendronate or risdronate. These medicines are often used for osteoporosis, a condition where bones become weaker and more likely to break. But these pills have very strict instructions. They are usually taken first thing in the morning with plain water, before any food, coffee, tea, juice, milk, mineral water, supplements, or other medicines. Many people are also told to remain upright for at least 30 minutes. That may sound fussy, but there is a reason. These medicines can be hard for the body to absorb. Food and drinks can reduce absorption. Also, if the pill does not move down properly, it may irritate the food pipe called the esophagus. The common mistake is waking up, taking the bone pill with coffee, and then lying back down. Or taking it with orange juice. Or taking it along with calcium because calcium is good for bones. But calcium at the wrong time may interfere with the bone medicine. The medicine and the supplement may both be helpful, but they usually need careful timing. Warning signs of irritation may include new chest discomfort, painful swallowing, heartburn, that feels worse than usual, or the feeling that food or pills are getting stuck. If these happen, contact your healthcare provider. The safer routine is to pick one morning each week, if your medicine is weekly, and follow the instructions exactly. Take it with a full glass of plain water, stay upright. Wait the recommended time before breakfast, coffee, supplements, or other pills. If you cannot follow these instructions because of swallowing problems, severe reflux, memory problems, or because you cannot sit upright, tell your doctor. There may be other options. This does not mean the medicine is bad. It means the instructions are part of the treatment. With osteoporosis medicine, how you take it can be just as important as remembering to take it. And now we come to number 7, which many people do not think of as a food interaction, but it is one of the most important for seniors. Number 7 is alcohol with pain medicines, sleep medicines, anxiety medicines, antidepressants, or diabetes medicines. Alcohol may be a drink, not a food, but it belongs in this list because it is one of the most common things that can interact with medicine after 60. A glass of wine with dinner, a beer while watching television, a small drink to help with sleep. Many people think a small amount cannot matter, but alcohol can make some medicines stronger, more sedating, or more unpredictable. And older adults are often more sensitive to these effects. This is especially important with sleeping pills, anxiety medicines, opioid pain medicines, some antidepressants, allergy medicines that cause drowsiness, and some muscle relaxers. Mixing alcohol with these can increase drowsiness, dizziness, confusion, slowed breathing, poor balance, and falls. And falls after 60 are not minor. A fall can mean a broken hip, head injury, hospital stay, loss of independence, or months of recovery. Alcohol can also be risky with common pain relievers. With acetaminophen, heavy or regular alcohol use may increase liver concerns. With medicine like ibuprofen, naproxen, or aspirin, alcohol may increase stomach irritation or bleeding risk for some people. For people taking diabetes medicine, alcohol can also affect blood sugar, sometimes in unpredictable ways. Low blood sugar may feel like shakiness, sweating, confusion, weakness, hunger, dizziness, or even fainting. The most dangerous part is that alcohol can make a person feel sleepy and relaxed at first, so they may not realize their coordination and judgment are affected until they stand up and fall. The safer choice is to ask your doctor or pharmacist directly, is alcohol safe with my medicines? Be honest about how much you drink. This is not about judgment, it is about safety. If you use sleep medicine, opioid pain medicine, anxiety medicine, or multiple prescriptions, it may be safest to avoid alcohol unless your healthcare provider says otherwise. And never use alcohol as a sleep aid. It may make you drowsy, but it can disturb sleep quality, increase bathroom trips, worsen snoring or breathing problems, and increase fall risk during the night. So let us bring this all together. After 60, your medicine routine is not just about taking the right pill. It is also about what you take it with, when you take it, and what food or drink is nearby. Grapefruit can affect certain cholesterol and heart medicines. Leafy greens can change warfarin control if your intake suddenly changes. Potassium salt substitutes may be risky with some blood pressure and heart medicines. Thyroid medicine can be affected by coffee, breakfast, calcium, iron, and soy if the timing is wrong. Certain antibiotics should not be taken too close to dairy or calcium-fortified drinks. Osteoporosis pills need plain water and careful morning timing. And alcohol can be dangerous with many common medicines, especially those that cause drowsiness, affect pain, mood, sleep, or blood sugar. But remember, the goal is not fear. The goal is awareness. Many of these problems can be avoided by doing 3 simple things. First, read the label every time you receive a new medicine even if you have taken something similar before. Second, ask your pharmacist about food, drinks, supplements, and timing. Pharmacists are trained to catch these problems, and one question can save you from weeks of trouble. Third, keep a simple medicine list. Write down your prescriptions, over-the-counter pills, vitamins, supplements, and even regular drinks like grapefruit juice or alcohol. Bring that list to your appointments. And most importantly, never stop a prescribed medicine suddenly because of something you heard in a video. Your medicine may be protecting your heart, brain, bones, blood vessels, thyroid, or kidneys. Always speak with your doctor, pharmacist, or healthcare provider before making changes. Your body after 60 may whisper before it shouts. Dizziness, unusual weakness, new bruising, stomach bleeding signs, muscle pain, confusion, palpitations, or symptoms that feel not normal for you should not be ignored. You are not being difficult by asking questions. You are being careful. You are protecting your health. Small daily habits after 60 can make a big difference. A different fruit. a better schedule, a few hours between a pill and a supplement, a quick pharmacist question. These small choices may help your medicines work more safely and more consistently. Do not ignore repeated warning signs. Do not guess about food and medicine combinations. And do not be embarrassed to bring your pill bottles, supplement bottles, or food labels to your next medical visit. Your safety is worth the question. Do not forget to like and subscribe. See you in the next video.